My name is Amar Gandhi, and this is my case study report on MedStar Washington Hospital Center for HAP 725, Dr. Alemi. Source of my data was, well, the rationale for selecting the measures was after researching online the most common complaints made against Washington Hospital Center, which is abbreviated as WHC in this PowerPoint, by patients on Yelp, Facebook, USA Today, etc. since 2014. The following 5 measures were determined as problem areas that Washington Hospital Center did poorly on and had the most patient complaints about. So the 5 measures being looked at for Washington Hospital Center using the HCAPS hospital Excel file from each year from 2015 to 2021 is first measure is communication level by nurses, and that data spans from 2014 to 2020. It used the HCAPS measure ID, HComp1 linear score, and it was the nurse communication linear mean score, and a lack of communication by nurses to patients about their treatment at times makes patients' experiences frustrating, especially in the ER, which, judging by many patient reviews, patients complain about quite a bit. Um, Timeliness of care is the second, and again, it's data spanning from 2014 to 2020. Um, HComp3 linear score was the HCAPS measure ID, and the HCAPS question was staff responsiveness linear mean score. And this means getting in and out of the hospital in a reasonable amount of time. For example, spending 10 hours in the ER for a minor problem, like some reviews mentioned online, is not considered timely care, and this hospital rates poorly on this. Then follow-up care is the third quality measure, and that data spans from 2014 to 2020. Its measure ID was HComp6 linear score, and the question was discharge information linear mean score. This includes follow-up care for patients who have been discharged from the ER and plan for follow-up, such as future appointments and keeping in touch with these patients until they are stable enough. And many healthcare facilities fail to follow up in a timely manner, which causes hospital readmission rates to be high. And then the fourth one was cleanliness. Measure ID was HClean linear score, and it was the cleanliness linear mean score. So cleanliness and sanitation levels in a hospital impact the kind of impression it leaves in patients' minds. Nobody wants to get treated in a dirty hospital. So a high level of cleanliness is associated with lower infection rates in the hospital too. However, this hospital rates poorly on how clean it is. And the last one is quietness, and that also spanned from 2014 to 2020. Measure ID is H quiet linear score, and the question was quietness linear mean score. So to recover faster, patients staying overnight in hospitals needed to be quiet, especially at night when they're sleeping. Lack of sleep can cause patients to have irate mood and behavior, as well as troubles concentrating and focusing the next day, like when nurses and doctors are instructing them to do something important. So now for the limitations of the data, one limitation was determining what to measure. Determining what the problem areas are at Washington Hospital Center by only looking at reviews and ratings posted online about it and a few news articles on it doesn't paint the whole picture. Instead, I should have went to the hospital in person and interviewed and surveyed real patients on what they find this hospital is doing poorly on. in an ideal situation. Only looking at historical data can skew my perception and make me think something that was a problem before but got fixed isn't a problem and isn't a problem anymore is still a problem. And then I would waste time focusing on that when there's nothing, no reason to focus on it because it's not a problem anymore. Another limitation is only using one Excel file, which was the HCAPS hospital limited, uh, and that limited the scope of my analysis. Ideally, I should have gotten data from multiple sources and combined them together in my analysis. The hospital competitors, so the rationale for selecting these hospitals to compare with Washington Hospital Center are they're all in DC with a approximate 10-mile radius of each other. And one of them, which is MedStar Georgetown University Hospital, is also run by MedStar, just like Washington Hospital Center. Two of them are university hospitals, so I can compare them with the other hospitals. And all four are private nonprofit hospitals. So the competitor hospitals that I chose to compare Washington Hospital Center on are George Washington University Hospital, facility ID 90001, MedStar Georgetown University Hospital, facility ID 90004, and Sibley Memorial Hospital 90005. So this was the first quality measure, communication level by nurses. And so this looks at MedStar Washington Hospital Center versus DC competitors, the average nurse communication level scores. So that's on the y-axis, and on the x-axis is the reporting year. So the average score for the nurse communication level for the three hospital competitors range from about 87.4 to 91.5. The only years where Washington Hospital Center was not within the range of the average scores for the three competitor hospitals were 2014, 2016, and 2017, because those were the years that their points lied outside of the control limit. Washington Hospital Center did its worst in this quality measure in 2017 and did its best in 2020. And it looks like Washington Hospital Center is on the right track now, as it has been staying the same and improving its score for this quality measure since 2018, which is for the past 3 years. The second quality measure is timeliness of care or staff responsiveness. So how responsive staff was to patients' needs at Washington Hospital Center. And the average staff responsiveness level scores are on the y-axis, and x-axis is the reporting year from 2014 to 2020. Um, so staff responsiveness to patients' needs at Washington Hospital Center was worst in 2014, score was 75, and tied for best in 2015, 18, 19, and 20, score was 79. 2014 to 2015 represents the sharpest increase in scores from one year to the next, 75 to 79, and 2016 to 2017 represents the sharpest year-to-year decrease in scores, 78 to 76. Quality measure number 3 is discharge information or follow-up care. So the average scores for how well discharge information was communicated to patients before they left Washington Hospital Center has stayed the same or gotten worse since its peak in 2015. Score was 87 until 2019 score was 84. So if Washington Hospital Center gets an average score of 86 or better for its 2021 data, it will be the first time this hospital has had 2 straight years of increasing scores for this measure. Washington Hospital Center's scores for this measure from 2014 to 2020 are far from both control limits, meaning the competitor hospitals had a broad range of their scores for this measure. Because all of Washington Hospital Center's data points are within the control limits and there's no patterns in the chart, that means that the process is in statistical control. Quality measure number 4 was level of cleanliness in patient rooms and bathrooms. And Washington Hospital Center was within the range of the control limits for 4 years, 2015 and 2018, 19, and 20. However, it was not within the range from 2014, 2016, and 2017. But each successive year, it wasn't within the range. Its score was higher than the previous not in range year. Scores increased each year from 2018 to 2020, which means there's a good chance this trend will continue at least for 2021 score. And the last quality measure, number 5, was level of quietness in patient rooms and hallways. So besides for 2017, and by a very small margin for 2014, all the other years were within the range of the control limits. 2015 and 2020 are tied for the highest scores for quietness level in Washington Hospital Center, the score of 76. 2017 had the lowest score, 72, out of all the years. And scores for this measure have been increasing or staying the same since 2017, with a good chance of having this type of score for 2021. So these are the summary of my findings. All 5 graphs have a very similar shape and pattern to each other. They all dip at 2017 and they all either go up or stay the same in 2020. So this means that Washington Hospital Center performed similarly for these 5 quality measures measured from 2014 to 2020 because some of them are related to each other, like quality measure 1 and 2, which was the communication levels and for nurses and the timeliness of care. 2017 had the lowest score for all 5 charts, meaning this was a down year for this hospital in terms of quality of care in most aspects. And 4 out of 5 graphs had an increasing score for 2020. Timeliness of care or staff responsiveness was the only one that didn't. This shows that Washington Hospital Center is on the right track as it looks to continue improving its quality measure scores. And lastly, all 5 charts had at least the majority, which was at least 4 out of 7 data points for Washington Hospital Center within the control limits. So this means that Washington Hospital Center is, for the most part, doing as well as its competitor DC hospitals, which are George Washington University Hospital, Georgetown University Hospital, and Sibley Memorial Hospital.